Okay, so now that we've taken a good look at the health history of the individual, we know what is giving them the pain, what positions, what types of activities tend to cause more trouble. We've looked at a physical exam, so we know, again, what types of movements actually increase the pain or actually relieve the pain. And then we've put that together with the tests that have been done, the x-rays, and specifically the MRI. Then we know exactly what type of herniation or bulge the person has. And specifically, this occurs in three planes of movement. So in other words, if you look at a disc and you picture kind of a jelly donut, the outer ring is called the annulus, which is kind of a hard fibrous coating, and then on the inner portion is the jelly, or called the nucleus. And how far and in what direction that nucleus pushes out will determine to what extent you can do treatments and the types of positions of treatments work best. So, for example, if a person, typically they'll have a disc bulge or a herniation that goes from the front of the person toward their back. But also, most of the time, it will also go to one side. For example, if this is in the neck and it's gone out the back and toward the right, that person will typically have pain from the neck that goes down into the right shoulder or the upper back or the shoulder blade, or sometimes all the way down the arm to the hand. They may have numbness or tingling in that particular position. And also for the lower back, if it's pushed out to the back and to the left side, that person may have the pain that goes down into their hip, their buttock, the thigh, all the way sometimes down to the foot. So the type of treatment that's done will be determined on how far that's been pushed out. And then sometimes if that jelly has pushed out all the way either to the nerve root or sometimes on the spinal cord, this can also affect organ function. And unfortunately, some people have so much pressure on their spinal cord that it does affect bowel or bladder conditions, and this very often, this person has to be referred to a surgeon. So as you look into the type of herniation and you look at in what direction this particular bulge or herniation has gone into and how it affects the person physically, then you can start talking about the type of treatment that works best. Now, in my chiropractic office, there are two main types of treatment. One of them is your standard chiropractic adjustment, which is a manipulation of the individual vertebra. And if you have individual vertebrae, the bones that are protecting the spine and the nerve roots, if they're fixed or stuck, they're not moving independently, then those vertebrae can wedge or tilt, which then causes the disc, the jelly of the disc, to push out in one direction. So, for example, a relatively young person with little or no arthritis that has a small bulge or herniation, this is the most effective treatment we know from research to get that person out of pain and also reduce the level of pain that will tend to come back in the future. So sometimes in addition to manipulation or sometimes alone, traction is used for that person that has a larger herniation or has other complicating circumstances like arthritis, or sometimes they're in so much pain with inflammation that they are not able to handle chiropractic manipulation. And so in my office, we have three different types of tables that we use. One of them is more of a manual, hands-on way of distracting as well as flexing the person forward to open up the space where that nerve is getting pinched. And the second type of table is motorized, where we can flex the person over a longer period of time. And then the third type of table is called spinal decompression. And this is used both for the neck herniation as well as the back herniation. And this is where a person is lying down on their back and they have belts that are strapped, for example, in the lower back to the hips so that you can have traction along the plane of the disc. And typically this will last for 1 minute in the traction phase where you're distracting the spine. which basically gets that jelly to create a vacuum to move back into the middle of the disc, followed by a 30-second relaxation phase. And this is typically done over a 30-minute period of time. So depending upon the level of the disc herniation and the angle at which the herniation has occurred, we may use any combination of those 3 different tables along with possible manipulation.